Good evening sa inyong lahat. Welcome po dito sa PHLV Radio. Magandang gabi sa ating mga viewers, listeners, followers, supporters, donors ng Filipino American Cancer Care. Again, thank you so much for being with us sa ating radio show on the air with FACC. My name is Josie Moralidad Zaiman, and today is Friday. My goodness, tomorrow is going to be July, ang bilis ng panahon. But of course, we would like to welcome everyone again sa ating pong radio show. At syempre, thank you so much sa ating station manager na si Mr. Johan. And ang kasama ko ngayong gabi, walang iba kundi isa sa mga board of directors ng Filipino American Cancer Care. We would like to welcome Emerich Richie Vicente. Hi, Emerich.
Hello, good evening po sa inyong lahat and magandang umaga po sa Pilipinas. Welcome to everybody. I'm really so happy to see and Ate Josie, it's been a long time since the last time I saw you. So that's why kind of, great to see you.
Ang daming trabaho.
I know.
Ang trabaho, ang sahod.
there's a lot of traveling that happened to you too, and you have a lot of guests as well. So yeah.
And Rich, we would like to take this opportunity bago natin interviewin yung ating mga guests ngayong gabi. If you have a copy, Emerich, ng ating free cancer screening, if you can go to our Facebook page, nandyan free cancer screening, magbibigay po ng libreng mammogram, pap smear, at colon test kit para sa colonoscopy or para sa colon ang Filipino American Cancer Care. And this is in collaboration with the Innova Hospital dito po sa Virginia. So, yung mga taga-state of Virginia. Yes, go ahead, Emerich.
Yeah, so I have the information here. It's going to be on Saturday, August 12 po, 2023 from 8 a.m. to 12:30 p.m. sa Innova Char Cancer Institute. It's going to be at the location in Fairfax, Virginia, and its cost is free. So libre po ito. This is going to be great for a lot of people that cannot afford to do the mammogram, 40 years old and over, no mammogram within the last year, screening only, and pap smear, co-pap, and HPV for those 21 to 65 years old, and no pap in last 3 years, no cancer diagnosis in the last 3 years. So this is for a good collaboration with Filipino American Cancer Care and Innova Char Cancer Institute. It's a free screening for the uninsured. So this is a really good program po. August 12 again, August 12, and it starts at 8 a.m. to 12:30 p.m.
That's right. And of course, we will provide transportation. At syempre, meron kayong breakfast doon. We're going to have some entertainment. And this is one of the projects of the Filipino American Cancer Care. Alam mo, Emerich, pag wala kang insurance, kahit na nga may insurance ka pa, mahal ang tinatawag na mammogram. Pati na yung pap smear and colonoscopy, mahal to. So this is free for everyone na walang mga insurance. Free cancer screening on August 12. Call me, okay? Call me, 571
Let me repeat that number.
Yes, go ahead.
Let me repeat that number. It's 571-241-8183 or 571-352-0165. Or you can email us at FACC, Cancer Care. The email is cancercare2022facc@gmail.com. Again, that's cancercare2022facc@gmail.com. The information is available on our Facebook page, Filipino American Cancer Care.
Yes. And also, we would like to take this opportunity to invite everyone. Ang dami nating events because alam niyo ang sabi ng iba, hindi ka ba napapagod? Of course, napapagod ako. Pero, ang dami kasing humihingi sa amin ng tulong, lalong-lalo na sa
Oo
Pilipinas.
nga.
And kahit dito sa Amerika, of course, we cannot save the world, di ba? Hindi naman natin
Yeah.
talaga magawa lahat. But we are trying our very best. That's why we're asking the support of everyone to help us, no, in the
Yeah.
fight against cancer. And we are going to have another event in September. Ito yung celebration ng Childhood Cancer Awareness Month. We are going to have a Zoom bingo, a Zumba, and then bingo. And everyone is invited sa Pinay Kitchen dito po sa may Woodbridge, Virginia. Check our website, check our Facebook page, and also our Instagram. And yung pinakamalaking event ng Filipino American Cancer Care is the FACC Runway for Cure, which is going to be October 28, 2023. Emerich, could you please tell them about the fashion show?
So the fashion show, this is our biggest fundraising event that will feature um, three international designers. That's just I guess a summary of their talents and skills. We have Jay Lyson. We got Carl Andrada, and then we also have Mr. Uy. Oh my goodness, I forgot his first name. Um, but we have those three international designers that's going to be joining us and showcasing all of their collections for the season. So we're really excited about that. And we will be our beneficiaries. Are we doing 21 again? Of 21 beneficiaries, Ate Josie? I think I lost audio on Ate Josie, but we cannot forward that event. October 28th, 6:30 p.m. It's going to be at Falls Church Marriott, Fairview Park, in Falls Church, Virginia. So be on the lookout. And we're really happy that our outstanding fashion director is going to be joining us from the MGI production from Seattle, Washington. Mr. Buboy Asuncion. So he's going to be helping us to direct that special event for October 28th. If you're speaking, Ate Josie, we could not hear you. So you can. So again, that's the designers are going to be Carl Andrada, Jay Lyson, and Edwin Uy. There you go. So please put that on your calendar. We still cannot hear you, Ate Josie. Yeah, we lost your audio, but that's okay. That's okay. So hopefully we can see you all there at the event, and then the bingo, the Zoom bingo that's coming up in September, and then the Pap smear next month in August. Please be there if you need that screening at no cost. Okay. All right. Well, let's move on to our guests today. Really excited. We have two special guests. Actually, let's make it four. Let's make it four special guests today. But the first, I'm gonna have her introduce herself. Dr. May Pastor Salvador. Please
Yeah.
go ahead and tell us more about you.
Okay, thank you, and good evening to everyone who's listening and watching over YouTube and Facebook. I'm Mayi Salvador. I'm a pediatrician and also a hematologist and oncologist. And I'm practicing here in Batangas province. And Batangas province, meaning it consists of from the surrounding Batangas City and the surrounding areas. Also, I cater for patients near the Batangas, and like it's the Mimaropa, which is Mindoro, Marinduque, if you are familiar. and
Wow.
Romblon, Mimaropa, and I don't have patients from Palawan, but Calabarzon area, mostly in Calabarzon area, like Calamba, Laguna, Rizal, Quezon,
Mhm.
and Batangas. So I've been in the practice, I've been practicing since 2022. And I think that's no, it's not 2000, 2000,
2002.
2002,
2002.
2002. And that's already 21 years. So, and in the case of our patient here, Abuela, the case is rather rare. No, it's an
Yeah.
infant.
Maybe let's go ahead and introduce the Buelas family. Let's go start with Zian. And then Zian, if you want to introduce your, I think, is that your wife and your daughter?
Yes, sir.
Yes.
Okay.
Uh,
And can you get your microphone closer to your, yeah.
Sir, I'm Mr. Zian Buela. I'm the one of the beneficiary of FACC before. The last runaway fashion show.
Yeah.
Uh, Sir, this is my wife and my only one child. She is baby Audrey.
Baby
She,
Audrey. Is it Audrey?
Oh,
yes,
yeah.
sir.
Audrey. Okay.
She is suffering from infantile leukemia.
Mm.
Uh,
Okay.
and now, sir, last February, in during her maintenance phase, he this yun po nag-relapse po yung anak ko
Mm.
last February. Meaning
Mhm.
po
Z-
ay kailangan niya po mag-ulit ng gamutan.
ah.
Mm.
Zian, anong pangalan ng asawa mo?
Mirna Buela po.
Okay. Hi, Mirna. Hi, Audrey. So,
Okay. Emirates, can you hear me?
okay, yeah. Oh my God,
Yeah.
clear, loud and clear.
Oh my gosh, nandito lang pala ako sa kusina.
That's okay.
Ang hirap na sitwasyon ko, Diyos ko, Lord.
That's
Okay.
okay. I'm welcome back, and we just started talking. We got Dr. May introduce herself, and then Zian is introducing his family, and he was just telling us how Audrey's leukemia she had a relapse. So
Yes,
now she
I
had to
was
go
really
back.
touched by the story of Audrey, no? Isa siya sa mga beneficiary natin sa FACC Fashion Festival last year. And that's why I reached out. And, we are trying our very best na hindi lang doon tayo natatapos sa $1,000. Hindi, kasi alam natin na mayroon pang kinabukasan itong bata na to.
Yeah, absolutely. And Dr. May, so how did you get connected with the Buelas family? If you can talk to us about that.
They came to my clinic for consultation,
Mhm.
and Audrey was then, I think, had easy bruisability and fever, so a bone marrow aspiration was done,
Mhm.
and it revealed acute lymphoblastic leukemia. And
Mhm.
since baby Audrey was 8 months then, uh, she's considered an infantile leukemia.
Leukemia.
Infant leukemia is rather rare. It's like 2 to 5% of all childhood leukemias. It's only 2 to 5%.
Oh my goodness.
Yes.
Wow.
However, um, the prognosis is it's okay. The prognosis is better, like
Mhm.
than before. It's like, I think, 80% here,
Okay.
70 to 80% here in the Philippines. In my cases, in my patients, but in in developed countries, it's like 90%.
Mhm.
So the treatment is based on its risk stratified treatment, meaning it's the treatment protocol being used for Audrey is based on the clinical presentation and based on the diagnosis and the risk stratification of this patient. Since this is a high risk patient, since she's in an infant leukemia.
Mhm.
So then, as the father told us, on this, she's already in the, I think, in the maintenance phase. However,
Mhm.
on the 6th month of maintenance, she went into CNS relapse, crane central nervous system relapse. So we have to repeat the everything. We have to repeat the
Yeah.
treatment and give another protocol, which is more aggressive. So, but then, although the prognosis or the outcome may be a little lower, it's still um, it can it can still be cured.
Okay. Okay.
Because I want to clarify that childhood cancer is curable.
Yeah.
Yes. Pero
Yeah.
alam mo, Doc, ang ipinagtataka ko lang, no, I'm just wondering why there are so many kids that by leukemia. Alam mo doon sa sa Rojas City, I was there in the Philippines last January years of living here in the United States. Meron po kaming mga bata na beneficiary doon.
Yeah.
Almost 50 sila. At karamihan talaga, ang kaso is acute lymphoblastic leukemia. And I
Yes.
don't understand this.
Yeah. Why is that so common there?
Oh no, it's worldwide statistics. The most common childhood leukemia in the world is ALL. It's acute lymphoblastic leukemia. So what we have here in the Philippines is consistent with the worldwide statistics.
Mhm.
But the reason why it is ALL is unknown. Why among all the tumors, ALL, the reason there is unknown. Maybe the genetics, the chromosomal abnormality. That's it.
Yeah, because sometimes you would think as well the environment could be, but it's so hard because what you said, it's worldwide.
Unknown.
Yeah,
Yeah.
it is
So-
worldwide. It is
Yeah.
it's the most common
Mhm.
childhood cancer.
Let's
Doc,
go back to Tatay
can I
Zian.
butt
Oh,
in?
okay. Yeah.
I just wanted to ask Doc, May, how did you
Yes.
find this family and what is it like na isa kang doktor? And there are so many overwhelming number of patients na may mga cancer. And it's way beyond here. Say I have cancer, but we have all the resources here. We have the best technology. In the Philippines, you have the best doctors, but you don't have enough resources, technology.
Mhm. Okay, first of all, it was really my problem before, although it's really a problem till now. But there are NGOs in the Philippines. In my case, I have a Cancer Warriors Foundation,
Mhm.
which helped my patients. They give free medications. They give free chemotherapy. Even they have bloodletting, and also they have this shelter.
Mhm.
It's a midway shelter for those who comes from the far flung area. So
Yeah.
they accept it in the shelter, and for chemotherapy, the shelter is near the clinic. And also the government now, they have a fair share in giving free chemo drugs. They have the PhilHealth has ALL Z benefit program, although the requirements are very stringent. And also the DOH have this the program, the CSP MAP, the Cancer Support Program, Medicine Access free medicine access. So, yun. So basically, it's a lot better now than before.
Mhm.
And also the treatment protocol, syempre, it's there are a lot of complications and with a lot of complications when you use a very aggressive chemotherapy protocol. But then we have a Batangas Medical Center, that's the PGH of the South, na I can bring patients there for free treatment.
Mm. Yeah. So what motivated you to build your own foundation?
Actually, it's not my foundation. I'm just a volunteer doctor.
Provider.
Yes, a
Yeah.
volunteer doctor. The story behind that was I have a patient whose mother is as resourceful as Zian, and who talked to the CEO of this Cancer Warriors Foundation, and then we connived together with Father Juni Maralit, who is now a bishop here in Batangas, now in Marinduque. And this collaboration, we started with one patient,
Mhm.
and now it's we have served 400 kids already, more than 400 kids. Right now, there's more than 100 kids, I think 160 plus kids on active treatment, meaning
Mhm.
ongoing chemotherapy.
And that's
And
in Batangas, Doc? That's in Batangas?
Batangas and surrounding provinces like Batangas City, Lipa, Mindoro, we have in Laguna.
Mhm. Well, and next year, if we go back to the Philippines, I would like to visit this area.
Yes,
Yeah.
please.
Yeah.
I
You know,
Yes,
my
I am inviting you, Ma'am Josie.
my
Uh-huh.
my best friends live in Batangas. I went to PUP, and my grandmother is from Laguna,
Uh-huh.
Pagsanghan,
Yeah,
Laguna. So yeah,
just
And
near.
also, I have a lawyer friend who is working in the Comelec, no, dyan sa Batangas. So,
Ah,
and her sister was actually a cancer patient na tinulungan din namin dito sa Amerika. And
mm, sana
I really would like to visit that area. Lalong-lalo na makita yung, yung ating
yeah,
beneficiary, si Audrey, at pa yung pamilya niya.
Oo.
yeah,
Sana
yeah,
po, hindi lang si Audrey.
yeah.
Mhm.
Yeah, we have a lot of asks, so it's probably there are some names out there on our list that's from your
Okay.
group or from the kids that you're helping. That's 600 you said so far? 400.
400 uh,
Wow.
has been served, but but the latest those undergoing,
Ongoing
yes, chemotherapy is 160 plus.
160.
Mhm.
Wow, that's painful to hear, huh?
Yeah.
160.
Can you
And
imagine?
that's just
Here,
a yeah, and that's is in a small surrounding places.
well, it's not really small surrounding because it some patients come from Mindoro,
Oh, okay.
from Quezon,
That's right.
from Romblon. I had a patient from
Yeah,
Romblon, Marinduque.
Mhm.
yeah.
And
Medyo
how
marami
long,
rin.
Doc, how long have you been a cancer doctor for kids?
Yeah, I've been in this practice for 22 years
22
already.
years.
Uh-huh. And
Mhm.
what inspired you to become a cancer doctor?
Well, the patients, because here in Batangas, I had my residency here in Batangas, and
Mhm.
um, um,
Are you from Batangas?
Yes, I'm from Batangas City.
Oh, Batangue. Oh.
Ay, ako'y
Yes.
taga Batangas. Marami ga kayo
Batangas eh.
Batanggenyo. Anyway, so I had a patient when I was in my residency with severe pallor. So parang ang putla niya. So dati kasi before my residency, yung mga doctors, they just transfuse. And then
Mhm.
wala na. The diagnosis is wala. Di nila alam, basta nag-transfuse lang. And then
Yeah.
babalik ulit yung patient, transfuse
Just
again.
a second.
So that patient inspired me to take my subspecialty na hematology and oncology. So yun. And also
I
my
see.
colleagues, my mentors would also ask me to undergo training in hematology and oncology because we don't have it here in Batangas.
Mhm.
That's the reason.
I'm so glad you did that.
Mhm. Okay. Now let's go back to Zian and his family. Zian, paano ka naman, no? Paano ka nakalapit sa kay Dr. Salvador and ano yung being part of that foundation?
Ma'am,
Hawakan mo yung microphone mo.
yun po kasing anak ko po ay nagkaroon yun nga po, lagi po siya nag-iiyak pagkagabi. Tas malaki po, napansin ko po malaki po yung kanyang tiyan. So nag-decide po kami ng akin pong may bahay na ipa-check up po siya sa pediatrician.
Mhm.
And then po, yung una pong pediatrician na nilapitan po namin, sabi po niya kagad ay may sakit daw po yung anak po namin sa dugo. So, nag-request po siya ng laboratory, tapos ay nung lumabas po yung yung result po ng laboratory, ipinadala niya po kami kay Dr. Mayi.
Hmm.
Then doon po na-revealed yung case po ng anak ko at kung ano pong klase ng leukemia. Ah, Tapos po, hanggang ngayon po, ginagamot po siya ni Dr. Mayi. Napakabait po ng doktor po namin. Kaya po marami po siyang mga pasyente galing po sa ibang lugar, kahit po hindi po taga Batangas. Kasi po kahit po kami tapos po kami sa pera, talaga po ginagamot po ni doktora yung aming mga anak. Napakabait po ni doktora kaya po talaga pinupuntahan po talaga.
Yeah. Ano bang trabaho mo, Zian, at yung asawa mo?
Bali po, dati po akong OFW. Yun nga po, yung anak ko nga po ay nagkasakit po. Kaya po napa-stop po ako ng pagpunta po sa abroad dahil po yung anak ko nga po ay 3 times a week po yung kanyang chemotherapy. Tas hindi pa po ako makapag-apply dahil nga po ginagamit ko nga po yung pera. Dito po kasi sa Pilipinas, pag mag-a-apply po tayo, kailangan po natin ng perang may magagamit. Yung anak ko nga po ay naggagamot po yun nga po, nagagamit po namin sa pagpapagamot po yung sa ngayon po ma'am, nagre-rely kami ng tinapay para po makasuporta din po sa pangailangan po ni Audrey.
So
Yung
sa
nag-
ngayon, wala kayong trabaho?
Opo. Nagpapa-order po kami ng mga tinapay para po may pansuporta po kami ngayon.
Si Audrey ba ang una niyong anak?
Opo, nag-iisa po naming anak si Audrey.
Mhm. Alam mo, napakabata pa nito ni Zian, ano? At gwapo to emerich na tao. Oh. Tingnan mo yan.
Ilan?
I'm just making you smile, Zian, you know. And how did you,
mahirap na mag-smile kapag yung anak mo may sakit, di ba?
of course.
Kaya nga po, lalo po sarat nag-iisa lang po yung anak po namin, talaga pong bantay na bantay po namin to. Halos hindi po kami umalis ng bahay. Baka nga po masaktan, magkapasa.
Mhm. At saka ang cute-cute ni Audrey. And
I
there was
know.
time, you know, there was a time he even texted me. Nasabi mo sa akin na Zian, that you even wanted to, kung may taong gustong mag-adapt sa anak mo dito sa Amerika, para lang mapagamot, emerich.
Oh my goodness.
Just thinking about that, Zian?
No po. Kung sa ikagagaling po yung aking pong anak, ay wala pong ano, basta gumaling lang po siya.
Ah,
Eh,
that,
nandiyan naman po lagi si Dr. Mayi po na lagi pong nakasuporta po kay Audrey na lagi po siyang kahit po pumupunta po ng clinic, kahit po wala po kaming pera, tinatanggap naman po ni Doktora dahil napakabait naman po ni Dr. Mayi.
Good Samaritan talaga to si Doktora, ha?
Dr. Mai, we need to duplicate you.
Yeah. And Dr. Mayi, pag nandito ka sa Amerika, please visit us
Please.
here in Washington, D.C.
Okay.
You have a lot of homes that you can
Yes.
stay at. You are welcome.
Sure.
Siya sa
Thank
mga
you.
events
Thank you so
natin,
much.
diba? Mhm.
And at some point, kapag ikaw naman, Zian, you know, your family, at some point, you know, you let us know. And
Yeah.
if we visit you there, we will let you know.
Mhm. And we are still, may mga ginagawa kami ngayon, no? I cannot say it in public right now kasi it has to be approved by the board, but we are thinking, I'm always thinking about, you know, Zian's a daughter and also the other cancer patient beneficiaries ng FACC.
Yeah.
As I said, hindi dapat natatapos sa $1,000 yung pagtulong ng FACC because, you know, cancer doesn't have a cure. But, you know, tayong lahat pwedeng magtulungan to be able to help the cancer patients. Now, I just wanted to ask again, Zian, how did you find out about FACC? Because we're only 3 years old. Kulang pa kami sa exposure and visibility.
Ma'am, dahil nga po yung ako nga po ay sa ano po, yung sinseridad po na yung po sa anak ko po na nagpapagamot, ay nagse-search po ako ng mga foundation po sa Google. Then nakita ko po yung FACC, yung Filipino American Cancer Care. Tapos po, nakita ko po meron po siyang Facebook page. So, inano ko po, nag-search ko po sa Facebook. Tapos po nag-send po ako ng message. Tapos nag-reply naman po. Yun po, kaya po na ano ko po siya. Kasi sa araw po kasi, yung mga papers po ni Audrey, nilalakad ko po yan sa government. Non-stop po yan. Tapos po ay pag dating ko po sa bahay ng hapon, i-start naman po ng online. Sa online naman po, maghahanap naman po ako ng resources para po kay Audrey. Para po masuportahan po yung kanyang paggagamot.
Wow.
Determinado talaga
Determinado, oo.
Yan.
Kasi it's your only daughter.
Yes,
Talagang,
and first
you
baby
do
pa, ha?
whatever you need to do to take care of your daughter.
Minsan nga po,
Yeah.
tumutulog na po ako ng 2 a.m. sa pag-search po ng mga foundation kahit po ang sinasagot po nila sa akin ay we are only helping the child here. Ganun po, malimit po ganun po yung kasagutan na kukuha ko. Pero diretso pa rin po kahit po no funds, yung foundation, diretso pa rin po ako sa paghanap, di po tumitigil para po kasi sa
Galing.
anak ko.
Yeah.
Alam mo, napaka-resourceful and this is the kind
Yeah.
of things na, di ba Doc, kailangan natin sa ating mga anak, lalo na pag may
Yes.
sakit
Karamdaman.
anak mo, di ba?
I really applaud his resourcefulness kasi hindi lahat ng magulang ganyan.
Yes.
Sometimes inire-rely lang nila sa tulong nung the foundation that I have here. But hindi kaya nung foundation dito lahat eh. Kaya. So kailangan talaga ng ibang na you go out of your way to look for others to
Resources.
support other resources to support the treatment.
Yeah.
So talagang magaling po si Zian.
Zian, nung nasa OFW ka, anong ginagawa mo doon?
Hindi po, isa po akong welder. Kaya po siguro po si Baby Audrey po ay siguro po dahil po iba't iba pong chemicals po kasi yung nasisinghot ko na
Lapit yung mic.
Lapit mo yung mic.
Siguro po ay kaya po si Audrey nagka-leukemia ay gawa din po siguro po sa work ko. Dahil nga po iba't ibang klase po ng metals yung sinusunog ko po dati nung nasa abroad po ako. Bago po si Audrey lumabas yun po.
I see. And how long were you doing that?
For 7 years po. Yun po
Okay.
yung-
Gumraduate ka ba sa Pilipinas?
Graduate
I mean,
po
sa
ako
atin?
ng high school po, tapos po nag-vocational po ako ng TESDA.
Okay.
So,
That's good.
Doc May. Doc, kumusta sa ngayon yung status ni Audrey, ni baby Audrey?
So as I said a while ago, she went into relapse on the 6th month of maintenance phase. So we have to restart the chemotherapy and change the protocol to CNS relapse. And then right now she's on the consolidate. She just completed the consolidation phase, and
Okay.
good news she's now in remission.
Oh,
The
wow.
prognosis. Okay, that's
Yung
good.
yung sa brain niya, 'di ba dati meron doon nga nag-relapse. The latest na sa CSF analysis namin was 'di ba Zian negative na sa blast cells. So
Okay.
sa leukemic cells. So yung bone marrow naman niya kasi marami yung pinupuntahan yung si leukemic cells. They are so intelligent. They will go to place in our body na hindi siya ma-reach ng chemotherapy.
Mhm.
And in her case, dun siya nagpunta sa brain.
Mm.
Pero yung bone marrow niya is normal. So in remission pa rin yung bone marrow niya up to the
Oh,
present.
good.
Mhm.
So I have high hopes for her na sana magdire-diretso. Yun nga lang, alam mo yung nakaka-hinder dun sa tuloy-tuloy na chemo is the infection. Yan yung number one, aside from the disease per se, ang second na cause ng mortality would be the infection.
Mhm. Yes.
It's more common pa nga.
Yeah, it's very, very common. So, sa ngayon ba, does she have any maintenance?
Ano pa po nasa consolidation, intensification phase na kami. So ang maintenance pa medyo malayo-layo pa. May ano yan merong parang meron parang
Stages.
ng cycles ng chemotherapy. You have the induction and then consolidation and then intensification and then maintenance.
Ilang months na ba na nasa second journey si Audrey?
We started last February so February, so March, April, May, June,
Wow.
5
Okay.
5 months.
Okay. And then expectations of this milestones process, another 5 months, another 6 months?
The treatment will be completed after 2 years, 2.5 years.
Mhm.
Wow.
Medyo may 2 years pa.
Mhm.
Absolutely.
Yan, ano yung mga challenges ninyo as parents? Of course, wala kang trabaho ngayon, nag-give up mo yung trabaho mo, and lang doc, no, na maka-totally, na siya, remission, di ba? Na okay na si Audrey, but then sa ngayon, kailangan pa talaga ng follow-up, di ba? Kailangan pa ng monitoring sa bata.
No, treatment mismo, Ma'am Josie. It's we're still undergoing treatment. It's not only monitoring. She's undergoing treatment.
It's a full treatment.
Yes,
It's a full
So,
treatment.
kailangan financial resources.
definitely.
Zian, sino pa yung mga tumutulong sa inyo ngayon? Yung microphone mo, hindi kita marinig.
Bali po yung mga close friends po namin, tapos yung family din po namin. Bali po, nag-start naman po ako ngayon na mag-apply po again sa ibang bansa po. Habang inaasikaso ko po si Audrey, kasi po may palapit po si Audrey na admission sa ospital na maximum po na 9 days po kasi dalawang admission po siya sa ospital na tigna 9 days po siguro yung maximum. Kailangan ko pong masikaso po si Audrey pagpasok po sa hospital dahil kami lang naman po nung asawa ko.
Lapit mo lang yung
Lupit mo
microphone.
lang ang microphone mo.
Kami lang po yung ng asawa ko po yung nag-aasikaso po sa aming anak. Halos
Mhm.
hindi nga po namin ito palabasin po ng kwarto dahil nga po baka po magka-infection. Dito lang po siya sa kwarto.
Mhm.
Dahil po sa
Mga
labas, sa
ilang
loob,
taon na nga siya ngayon?
2 years
Two.
old na po siya mahigit.
Nagsasalita na ba siya?
Bali po nagsasalita na po, di po namin alam kung English po yung salita niya dahil po sa kanya mga pinapanood dahil po di po bihira po siya magsalita ng Tagalog po siguro dahil naririnig po namin puro English po eh.
Dahil ng Cocomelon.
At
Dahil
saka
po
Doc,
nung-
di ba, ang cute-cute talaga ng bata.
Yes. Sana mapakita ni Zian.
Oo, pwede ba nating makita si Audrey?
Audrey!
Kasi gwapo din tong tatay na to eh.
Kanina nasa kwarto. Kanina nasa kwarto sila eh.
Yan.
Oo. Nahihirapan doon sa microphone kanina rin eh. So, we'll see. Thank you so much, Doc May, for all of the things that you're doing.
You know, she's not only a doctor but a good Samaritan.
You're a good Samaritan.
Thank
Doc.
you.
Oh,
Audrey.
hey. Ay, siguro tanggalin mo na yung ano mo, no, yung
Ayan. Ay, ang cute niya. Wow.
Opo, cute siya. Mistisahin.
Alam mo, may ipapadala ako dito kay Audrey. Ano bang gusto niya, Zian? Ano bang hilig niya? Mahilig ba siya sa laruan? Anong gusto niya? Libro? Ano ba?
gusto mo tanggalin mo yung earpiece mo sa phone mo para marinig.
Ayan o.
Gusto po niya yung mga nagsusulat po siya, nagdo-drawing po siya. Ganun. Tapos
Ayan.
mga laro yung po mga
Interactive.
laruan na animal.
Yeah. So for just really quickly, because I know it's broadcast live in Facebook, for all of the listeners and viewers on sa Facebook tsaka sa YouTube, this is Audrey. She is our cancer patients that we supported last year for our FACC fashion runway for oh my goodness, I forgot the name
Fashion
of the title.
Festival.
Fashion Festival last year. And then basically she was doing okay, and then suddenly she had a relapse in February, and
She's
then
under treatment right now.
and then now she's under treatment pretty much for the next 2 more years, for the next 2 years. So and Zian is the father of Audrey, who's trying to figure out how to get all of the help that Audrey would need. So beautiful little girl.
Do you have something else to say, Zian?
Yun nga po ma'am, yun nga po, yung kung may gusto pong tumulong po kay Baby Audrey, saka po dun sa mga bata po na, kasi po nakikita ko po talaga sa clinic po ni Dr. Mayi, marami pong bata na kailangan po ng tulong.
Gusto ko talagang makita yung mga bata na yan dyan sa Batangas. And I will try my very best na makauwi next year. Rich, samahan mo ako, ha?
Yeah, I have a nephew who's graduating doctor. So
Okay.
yeah.
Usapan natin yan, Rich.
Yeah.
Next
absolutely.
Uh-huh.
Yeah, next year.
Doc, wag mo pabayaan si Audrey, Doc, ha?
Oo.
Kasi
Gagawin
parang anak
natin
na rin
lahat.
natin yun, di ba?
Oo. Tsaka ang ano kasi, napaka-supportive nung parents.
Yeah.
Talagang gagawa sila ng paraan. Makikita mo na yung kanilang talagang grabe yung passion nila para
Si Zian, bata pa siya, but he's doing his very best, no? Hindi lang bilang isang ama, kundi talagang I will do everything na magamot itong bata na to. And he doesn't stop. He never gives up. Ano pa kaya ang bata, di ba?
Zian, I'm happy that yung pamilya mo is trying to help you and si anong pangalan ulit ng asawa mo? Si Marian? Marian ba?
Mirna.
May Mirna.
Mirna.
Mhm. Zian, ano ang mga natutunan mo dito sa sakit na cancer?
Marami po natutunan ko po na magtiwala po sa Diyos, ano po ng devotional prayer para po marami po ako natutunan na mga bagay-bagay.
Lapit mo yung microphone mo.
Marami po ako natutunan ng mga bagay-bagay po lalo po sa cancer kasi po pinag-aaralan ko po talaga yung sakit po ng anak ko kahit po sa Google po sinesearch ko po pag po may ganitong nangyari, ganito na ano po. Sinesearch ko po talaga siya kung ano po ba ang magiging status po ng anak ko. At yun nga po, salamat po kay Dr. May na patuloy po na suporta po kay Baby Audrey sa paggagamot po niya. Sabi ko nga po nung kaya po ako naging ganito po na gusto ko maging resourceful. At pangako ko po kasi kay Baby Audrey nung madiagnose pa lang po siya. Sabi ko po kahit po manlimos po ako sa lansangan, mapagamot ko lang po siya at makamit po niya yung kagalingan sa kanyang karamdaman. Kahit po anong hirap, kahit po anong pagod po yan, handa po namin yung isakripisyo basta po yung makita lang po namin na masigla yung aming anak. Na malusog po siya, wala nang sakit.
Okay. And I hope next year, pag bumisita ako dyan sa Pilipinas, puntahan kita, Zian, makita ko kayo. And of course, si Doctor, di ba? I hope to see you, Doc, dito sa Amerika and of course, dyan sa United or sa Pilipinas. Emerich, pray for me na successful yung aking operasyon.
I
Para
will.
Punta na tayo, balik na tayo sa Pilipinas, di ba?
I will. I will.
So thank you.
Ganun din ang gagawin ko when I visit. I will let you know.
Oh yes, of course. We really have to see them. Iba kasi yung feeling, Doc, na nakikita mo yung mga beneficiaries. And I was there last January at alam ko yung feeling kahit na may namatay after I went back to the United States. But yung mga bata, kasi nila this is about their life, their future, di ba? At tayo din naman, lalong-lalo na if you believe in the fight against cancer, di ba? We need to be united. Now, thank you so much again, Doc. You have something else to say? I think we have 5 minutes.
Okay. First of all, I would like to thank FACC for accommodating and helping one of my patients, Ibuela. And I hope that we can also make a collaboration with other patients also.
Yes.
And also, sana wag kayong magsawa sa pagtulong sa mga batang may cancer. And also,
marami pa yung ating mga donors.
oo nga, sana yung mga nakikinig ay wag magsawang tumulong. Because childhood cancer indeed is curable. I had a patient na ganyan din ng case, 6 months old, nagkaroon ng leukemia. And right now, graduate na siya. Cancer-free. For like, I think, magto 2 years na. When you say cancer survivor, it means remission ka for 5 years.
Yeah.
So now, naka 2
Ito,
years.
na lang, 6 na buwan, tapos na ako sa treatment.
You also have? What type of?
I'm fine.
Okay. Anyway, so thank you again, and I hope you will be with me in this struggle, in this passion in treating cancer patients. Thank you so much.
Thank you so much, Doc, and we are looking forward to seeing you there in the Philippines. And Zian, lastly na lang yung message mo, Zian. We have 3 minutes.
Thank you po sa opportunity po na makasama po dito yung family ko po sa dito po sa FACC. Salamat po. Sana po suportahan niyo po si Baby Audrey dahil po talagang napaka-strong po ni Baby Audrey. Talaga po lumalaban po siya. Lumalaban po siya sa sakit niya.
Mhm.
Sana po ay patuloy niyo pong extend yung kamay niyo po sa pagtulong po kay Baby Audrey. At sa lahat po ng mga cancer patient. Salamat.
Okay. We will keep in touch with you, Zian, ha? And God bless you and your daughter, Audrey. Siyempre, sa asawa mo rin. Emmerich?
Yeah, thank you so much, Doc, for everything you do. Good Samaritan, doctor, everything. You're like the mother of all those children, you know? You're the second mother of all of those children. And Zian, hang in there. You have
At sana,
many.
Emmerich, lahat ng ama katulad ni Zian.
I know, yeah. Lahat ng, kung pwede lang, na lahat ng tatay doon sa katulad mo.
Mhm.
And even moms, you know, even mothers, they have to be resourceful as well. But no, you have a lot of prayer warriors that can help you. So, you know, lahat tayong madasalin. If, you know, anything that we can do, and hopefully what you ask for all of our donors to not, you know, don't get tired of helping. That's the key, because we won't be able, FACC will not be able to help without the help of our donors and our you know, our supporters out there.
Mhm. And we rely on our fundraising efforts. Thank you so much to PHLV Radio, especially to our station manager, Johan, for being with us, no, every Friday dito po sa PHLV Radio in Las Vegas. Again, this is Josie Moralidad Zaiman and Emmerich.
Emmerich Vicente. Thank you all so much.
And we are looking forward to seeing you again. Bye. Have a nice
Bye-bye. Have a good
Bye.
have a good morning. Good evening.
Good evening. Bye.
Bye-bye.